All those who tested positive for Ebola, 2 died, then the rest have been treated successfully and they have been discharged. The last one, who was a Congolese national, was discharged this morning. So as of now, we have 0 cases in the country. So like I have said, the case fatality rate means of those whom you tested positive, how many have died. We lost only 2, which translates to 10%. And for this strain of the virus, the case fatality rate usually ranges from 25 to 36%. That means we have done very well. We have not lost many of our patients. The other strains like Ebola Zaire is extremely virulent. It can kill up to 90% of those who test positive. But this one is a little less mild, but it can kill up to 25 to 36%. But this is an average. If it finds when you don't have a strong system in the country, it can also kill up to 90% or even beyond. So the fact that we've been able to have a low case fatality rate means our response system has been fairly effective. And even those who died, yes, you can clap for that. Even those who died, they died because they presented late. They presented late. And in the last 21 days, we have not registered any positive case. And in the management of Ebola, when a patient tests positive, then you trace back and get to the contacts. Anybody who has been in contact with that patient in the last 21 days, you round him up, you bring him to isolation. And we did this. And through that system, we were able to identify 836 contacts who were in touch with these 20 cases that tested positive. We put them under isolation. They completed the 21 days. None of them developed symptoms. None of them tested positive, and they have all been discharged. And that is a very important element in managing Ebola disease. Now, compare these results with what is happening across among our sisters and brothers in the DRC. I spoke to the officials. As of today, the 16th of July, they have 2,011 Congolese who have tested positive for Ebola. And they have lost 754 individuals due to Ebola. So in Congo, I was there a few days ago in Bunia, leading a team of Ministry of Health and WHO. I am very safe. I am very safe, Right Honorable Speaker. What we see in Congo is that the outbreak, the Ebola disease outbreak, is outpacing the response. Because despite the efforts there, it is increasing rapidly. It began in Ituri province, but there have been reported cases in North Kivu, South Kivu, and I think this morning I got a report, there are 2 more provinces where there are reported cases of positive identification of Ebola. So there, things are not as good as they are here. Now, without going into the details, I'm sure when you access the report on your iPads, you'll be able to read the details. But I can safely say we have done fairly well, courtesy of the experience we have gathered over the years, because the past...
Thank you, Right Honorable Speaker. The small clarification I want to raise, whereas I want to thank the ministry so much for the work that you have done and how you have managed the disease. The clarification I want you, before you conclude, to raise, and that's why I came, is the issue of announcing that we have Ebola? Because when this disease comes and you're managing it very well, why does the information come out very fast that there is Ebola in Uganda? And when we travel, there is a ban everywhere. People start looking at you with scorn that you have Ebola. I want you to handle that particular matter when you are discussing, as you're concluding your statement, that particular area of announcing, and the Minister of Health announcing that there is Ebola in Uganda. Honorable members, this is a very important matter.
Honorable Minister, do you want to conclude? Do you really want to conclude?
The right honourable Speaker is
If you don't want to conclude, you will be giving other people to clarify. But
Okay.
you are the most clarified minister from Ministry of Health. I would think so. You are also the most.
So thank you very much.
The most informed Minister of Health. So inform the House and resume your seat, and we get the opposition to also summarize in 3 minutes, and then we see whether there are some lessons we can take from that. These are, okay.
Thank you very much. In the health sector, we operate a policy of openness. And the World Health Organization international standards require us to make a notification when we get these rare diseases, like viral hemorrhagic fevers, like Ebola. So, professionally, it is not acceptable that you get this kind of illness and you keep quiet, because keeping quiet might result in other people getting infected. And that has been the policy in Uganda. You recall, Right Honorable Speaker, that even in the 80s, when countries were fearing to say they have HIV and AIDS, President Yoweri Museveni authorized the then Minister of Health, Dr. Rakana Rugunda, to go to Geneva at the WHO Assembly and announced that Uganda has a big problem of HIV and AIDS. And other countries were laughing at us. How do you tell the world that you have this problem? But because of that openness, we were able to contain HIV and AIDS, and we are one of the countries that is on record for having successfully handled. But probably the advice you are giving is that while we should not hide information, but we should communicate in a manner that does not result in injuring our national economy and interests. Right Honorable Speaker, let me just explain one point, then I sit. Discharging the last patient does not mean that the country is Ebola disease free. The World Health Organization standards and recommendations is that when you discharge the last patient, then you start on a countdown. The incubation period of Ebola is 21 days, is up to 21 days. So we count 2 cycles of the incubation period. So we shall count starting 21 days, those are 42 days. So if in the 42 days we don't register any positive case, then Uganda will be declared Ebola free. What we have done, Right Honorable Speaker, is that our president talked to the president of DRC, and the 2 heads of state agreed that we handle this outbreak jointly at the 2 governments. And the 2 ministers of state signed an MOU. I signed on behalf of the government of Uganda, and my counterpart, Minister of Public Health in Congo, signed and agreed on a number of interventions to jointly pursue. One of them, which we agreed on, it's very important, I inform Parliament, is that this is an imported outbreak. It came into Uganda because Congolese were coming to Uganda for better medical care. So we agreed that the government of Uganda will support the Congolese government by establishing Ebola treatment centers on the other side of Congo. And the president authorized us to open up to 4 centers. We have so far opened one in Aru,